Welcome back. I am so excited that you have joined me again in the Aligned Womb, Aligned You podcast. I'm Kate Nagai, and I am your host and womb guide on this journey. I'm here to help you to lean into the language of your menstrual cycle so that you can align yourself and awaken and activate to your womb wisdom to live the most inspired life. I am so excited to jump into this episode and to dive into today's topic. So let's get started. Hello, everyone, and welcome back to the podcast. This week, I am so excited to have one of my favorite naturopathic doctors on. Dr. Briana Lutz is a naturopathic doctor, like I just mentioned. She provides family medicine with a special focus in women's health, fertility, and perinatal care. She is a women's health advocate, which obviously is probably one reason why I love her to bits, and was drawn to the specialty because she understands that women's concerns are often palliated, dismissed, and ignored. She is here to evolve the conversation and provide the highest level of care to her patients. She treats conditions such as PCOS, endometriosis, fibroids, and functional hormone issues that result in PMS, heavy and painful periods, and acne problems. Dr. Lutz supports family planning options and contraception, as well as women in natural hormone transitions, such as postpartum and menopause. Welcome to the podcast. I'm so excited to have you here, and I'm really excited about our conversation today. I've had Dr. Lutz on here a few times, or not on the podcast, but in my programs to talk about fertility and egg quality. And it's always blown not only my mind, but the people that are in those containers of how much they didn't know about their bodies, what was happening with their fertility, their eggs. And it's always been so inspiring for them to walk away and feel more empowered by knowing that they're not without options. And I feel like this is so important for people on the fertility journey. And in particular, we're going to talk about fertility, but we're also going to talk about a little bit about miscarriage today and recurring miscarriage, which is a topic dear to my heart. One thing that I found there, a lot of the clients that I worked with that are going through recurring loss and that I was seeing happening is that there's just this deep level of brokenness and they're feeling without options. And one area that, whether you want to call it naturopathic medicine or whether you want to call it holistic approaches, one thing that they helped me with was grounding in that I had so many resources in myself. There were so many more options. Like the road was not over. And that's where I felt there was this huge disconnect from the medical world, or what we know as the conventional medical world, because there really was so many unknowns. It was just, I could be tested and I was just asked to be left in their hands versus being given resources to take back my own powers. So I'm excited to dive into this conversation with you today.
Yeah, thank you so much for having me. It's always such a blast because you bring such interesting perspective and knowledge, and you work with so many women on this fertility journey. So it's so lovely to have your insight and also just support in having me on. So thank you. I appreciate it.
So what led you to want to work deeper with women's health and in particular fertility?
Yeah, I think for me, it was my own health concerns. And I feel like women's health, as you mentioned in kind of my bio, is that we fall through the cracks of conventional medicine. Typically, our options are very drastic and very severe. So it's like, here's the birth control pill, get a hysterectomy, end of story, right? So I think that there's this huge spectrum that we're missing in terms of options and interventions. So that's where I was really drawn to support women's health, is there are more options. There are more ways we can support you from a functional perspective. And then as I started working with women's health in practice, I started to see more and more fertility patients, because even from a marketing perspective or starting my practice, you talk about hormonal imbalances, but a lot of people don't know what that means, right? Or how that's presenting for their body. So a lot of people were drawn to me because they're like, okay, if fertility is a hormonal issue, then maybe, Dr. Lutz can support me. So my fertility practice started growing and evolving. I am a huge nerd when it comes to fertility, it is so multifaceted because it's not just about your hormones, right? It's how your digestive system is playing into your hormones. It's how your neurological system is playing into your hormones, your nutrition. There's a huge kind of shift or deepening knowledge about like reproductive immunology. So how the immune system is impacting fertility as well. So I go down so many rabbit holes. I do so much research and it keeps me current. It keeps me, I love learning. So I think that fertility just kind of scratched an intellectual itch for me. I also think that fertility is like this very interesting work because you support people in their highest highs, but you're also supporting people in their lowest lows. So I think too, that's where I'm starting to see a lot more women dealing with recurrent pregnancy loss, because I think, again, that's a crack in the conventional system that women are falling into. So it's really an honor to support those women.
Yeah. And, I think that, at least for my story and for so many that I've worked with, the reason why we start to explore and investigate our hormone health during fertility is because a lot of what we're taught younger during puberty and even in our 20s is that it doesn't matter, right? Like painful periods are just something you go through. Even menopause, like I'm so surprised listening to my aunts and my mom when they were transitioning of just like, well, this is just what we're supposed to go through. So like, we have to live with this. And there's no other dialogue to teach us that, no, there's a different way to feel in our body. There's a different empowered way, and that there's better tools than just birth control and antidepressants. And I say that really lightly. There's definitely places where antidepressants are needed for depression. But I think sometimes those are overprescribed because women are feeling sad in their luteal phase, or, they're feeling so much shame, or like there's these bigger scars that are happening because how we are not allowed to express as women. And it has nothing really to do with the fact that we are depressed. It's that we're not seen, we're not heard about what we're feeling. We're being dismissed. Mm-hmm. And when those are addressed, at least this is what I have found in my practice of working with women on fertility journeys, is that there's high success rates in my program. And it's not because I have a magical tool, but it's for the first time they're heard. For the first time they're in a community of women that are saying, yeah, me too. And their first time in a space where they're told, no, you are empowered. I'm not here to fix you. I'm here to give you all these tools because there's so much to be hopeful for. And that's what changes the chemistry of their fertility journeys. So,
yeah. Yeah. And with this recurrent pregnancy loss or miscarriage piece, I think it's about breaking, I don't know if I'd necessarily call it stigma around miscarriage, but like my parents' generation, there was this notion, or I don't know if this was perpetuated by doctors, but it's like, you don't tell anybody you're pregnant until 12 weeks, right? Because there is so much loss, or that's, we'll talk about kind of, is miscarriage common or normal? And so there are more frequency of losses before that 12 weeks. So people say, don't tell anybody, right? And so there's these women who are having pregnancy losses, maybe recurrent pregnancy losses before this 12-week time frame, and they're feeling isolated, right? They have no one to talk to because nobody knows they're pregnant. So I think we're doing a better job of the conversation evolving around pregnancy loss. And so these women are just feeling more supported, or it's not until somebody struggles with their fertility journey and shares it that all of their friends or their aunties or whatever is like, me too, right? Exactly like you're saying. Program. And I think we need that village. We need that support for people in these losses and in these instances.
So you had just touched on a point that I would love to dive into. Is miscarriage common? This is the big question.
Yeah. Is miscarriage common? Is miscarriage normal? So I believe the statistic is like 1 in 4 pregnancies will result in a miscarriage, right? So there are, especially in like the medical algorithm, like when do we investigate? Because is miscarriage normal, right? So how I like to frame this is that our body is very intelligent about regulating cellular replication, right? So if there's abnormalities, we have checkpoints about what is that cell normal? Is that functioning normal? Does it have the capacity again to evolve into a fetus in pregnancy? And we see like the opposite of that. If we have unregulated cell growth, that's cancer, right? So our body is really tightly regulated about normal cells replicating. So to a degree, there is a higher incidence of miscarriage because our body is regulating that cell growth, right? If there's an abnormality, we will, terminate that cell growth. So that's where we're kind of getting stuck in that miscarriage is quote unquote normal. And that's where doctors aren't going to investigate after one miscarriage. However, the reason for one miscarriage will also be the reason for your second, for your third, for your fourth. And so I treat every miscarriage, every loss as an investigative opportunity. The most common or the most quote unquote normal is again, like a genetic abnormality, right? The cells didn't replicate properly. Again, that's where we see really early losses or maybe a chemical pregnancy. But we can do some other investigations. Part of it too is like, your fertility journey doesn't stop when you get pregnant. And I think this is something that I'll talk about more in another space. But for instance, PCOS can make it a lot more challenging to get pregnant. And some of the issues with getting pregnant can also be part of your issues staying pregnant. So if somebody's coming to me for fertility support and we get them pregnant, I have a contingency plan. I am anticipating all the potential obstacles of what could result in a pregnancy loss. So we have those checks and balances in place. And I'm trying to give people as much insurance as possible when it comes to their pregnancy, whether that be naturally or whether it be supporting like assisted reproductive technology, like IUI or IVF as well.
Mm-hmm. And I think, and this might be a big tangent that I might be going down as well, but I feel that medicine as we know it, or what we'll call medicine, hasn't done a great service of helping women move through loss or move through these diagnoses. Because like you just said, chemical pregnancy, like we have all these terms that we use when it comes to women's health, which are not empowering terms, like failure to progress. I had an incompetent cervix. Like, what the hell's an incompetent cervix? Like, we have all these terms that we use to describe the woman's body, which really doesn't keep us connected to our body, but keeps bigger disconnection. Like, I don't know how many women I work with that are like, well, I had a chemical pregnancy. No, you had a pregnancy. That's a medical term, but you still had a pregnancy that you lost, right? And so I think this is a big emotional part, a big emotional piece that comes with miscarriage and why women struggle is because, like you said in the beginning, we also are starting to see all these other different systems coming into play with our fertility journey. So neurologically, when we keep repeating to ourselves these terms, we're also not feeling empowered that we could achieve pregnancy or that we can have a full-term pregnancy, right? And so I think language is one of the key factors that have stunted us in our journey.
Yeah. And I think that that's a huge advantage for like naturopathic medicine, alternative medicine, is we have that time and space, and we're trying. And the thing is if you don't understand what's happening in your body, I haven't done my job correctly, right? Mm-hmm. So you have a 15-minute visit with your medical doctor. They throw all this medical jargon at you. You're like, what the heck just happened? So for me, like, language is always something that I'm trying to check, and even, those slip ups still happen because, again, we're going off based off of like med school and all that terminology. But again, when we talk about quote unquote chemical pregnancy or those early losses, to me as a clinician, that is helping me understand what the obstacle is so I can create a better opportunity for a completion of pregnancy or a successful pregnancy resulting in a baby. So, yeah.
And I think one thing that you're very talented at is getting women so that they feel into their own body and they understand their body in a language that is supportive and not necessarily creates a deeper disconnection with their body, which I think that's why I'm so drawn to naturopathic medicine, is because it was the first time that it made me feel like there was options, that there was hope, that I don't know, that I was back in the driver's seat, right? That I had so many more options. It might be more work. One thing that I have discovered with, the healing journey, which I think is what so much of naturopathic medicine is about, is that we're healing. We're going to the root cause. So it takes longer. And I think we're trained that it's easier if we just get the quick fix. But I think that's a lot of sometimes emotional bypassing as well, of us going, I don't want to feel that. I don't want to sit in that. Mm-hmm. But then that also lays into the layers of feeling more broken than healed. So, and before we go deeper, because I'm sure that there's going to be some people listening to this maybe that are like, what is the difference between naturopathic medicine and conventional medicine? Because I think a lot of people think that naturopathic medicine has no real basis, that it's just someone who's giving vitamins, which is really not what it is about. And, you touched on one point that has been a key element for me, why I have chosen that for my whole family. This approach is because it's not 15 minutes. It's always an hour to 90 minutes. Like, it's always a conversation.
Mm-hmm. So naturopathic medicine, how I like to frame it to, somebody coming to see me for the first time, is we actually function as primary care providers. So we are trained to be primary care providers, meaning that we can assess and we can diagnose. I think it's just depending on the scope of your capacity in the province, because your province legislates what your scope applies to. So we have some limitations in Alberta based on certain assessments that we can run. And so as a primary care provider, technically we should also be able to refer to specialists, right? So that is something that we don't have within our scope. So if I diagnose somebody with cancer in my practice, I have to send them back to their GP to then refer to an oncologist. So there's a little bit brokenness within that system, but we are trained to be primary care providers. The obvious difference that a lot of people associate us with is that we utilize natural therapies, right? So not pharmaceuticals. That doesn't mean that I am not that I'm against medications. And oftentimes my recommendations are working synergistically or don't directly interfere with, medications that some people are already on. But it just means that we are the experts in natural therapies, whether that be vitamin and nutrient support, whether that be botanical medicine. We are kind of that authority in that. But the main difference between us and conventional medicine is we're really getting at the root cause of why something is happening rather than just chasing around symptoms. So we do a lot of detective work. And for me, even if somebody's presenting with a constellation of symptoms, I'm not using like a supplement for each individual symptom. I'm seeing the commonality or that origin of that and treating that. So then we're alleviating all of these symptoms, at the same time. So And then as to your mention, we work as a team. So while I'm like, quote unquote, the authority, I don't view it that way. I bring my medical knowledge and my expertise and a strategy, but you know your body best. So anything that I'm recommending, you're giving me feedback to be like, that's not, conducive to my lifestyle. I've tried that before. And I'm also gathering information and intel with that. Somebody being like, I was on birth control when I was 15. I was the most depressed I've ever been in my life. Then I was put on an antidepressant, right? So I'm understanding, okay, that intervention didn't work. This is probably why. This is what's happening in your system. And that's further giving me more pieces to the puzzle. And to do that investigative work, we do need time, right? So the sign in the office of like one chief concern only, that's not us. Like, I want to know all the stuff because it's like me doing a jigsaw puzzle and you're showing me the picture so I can put all the pieces together, as opposed to me looking at all of your symptoms as being these isolated anomalies.
And I love that. And I think when it comes to women's health, there's so many different elements. Like, I know for myself, I just had the Dutch hormone test done, and it made sense. Like, when I sat with my naturopathic doctor and we went through it all, and we were looking at like just normal things like my brittle nails or the loss of hair that I've been having lately. Like those could all be just like coincidental things. But when we lined up like how many things were all happening, and then we looked at this test that happened that tested my hormones, then it was like, well, this all makes sense because all these things kind of fit within this diagnosis, right? And so I think that's one thing that I really truly appreciate is that it is looking at all these little things that sometimes we might just take for granted, that it's like, oh, it's no big deal. That's happened forever. Like that's just a part of who I am. And I know from my studying of Ayurvedic medicine, it's the same kind of thing, is that we want to look at your whole constitution. We want to look at your personality, like what gets you riled, what gets you calm, right? Because those tell us a lot about also your system and how to work within it. And I think that's why I would always recommend, don't discredit alternative approaches, or I don't even like the word alternative, complementary approaches, because there's so much that they can do to complement what you're going through, no matter what route you're choosing, particularly if you are going through IVF or IUI. There's so much support that can still happen with having both on your team, right? When I was pregnant, I had an incompetent cervix. I was so lucky to have a midwife that was like, no, I'll still keep you under my care because this is what you really want. Because she knew the work that I was doing, how much I worked to heal my body and all the people that were on my team of help. And she referred me to a specialist. Like I didn't do it one without the other. And they talked to each other, right? So I still had to go for my every week ultrasound. But then I also had my midwife who supported me and coached me for what I needed emotionally. So yeah.
And I think like you made a good point about things that we're thinking are normal because we've dealt with them for so long, right? Like, oh, I poop once a week and they're like, that's just my body. I'm like, maybe not, right? So it's just like things that we live with. And again, like we can see this perpetuated into pregnancy loss, where it's like, is it, even though it's potentially common, is it normal, right? And that's kind of where we need to do that investigative work.
So going back to the miscarriage and the recurring loss, in particular recurring loss, because I think this is a hard one for women who finally achieve pregnancy and lose, and then are told this is just a part of life. Like this is just part of what happens. You know, we can't do anything until you've had at least 3. Because a lot of times, and I don't know if that's changed from when I did my research, but I know at the time I was doing my research that in order for any kind of big medical intervention to happen with conventional medicine, you had to have 3 or more losses before they would even look at it or do any testing, because otherwise it was just normal. It was part of, trying to have a family, which is so hard for anyone that's going through it.
Yeah. And I know historically it's been 3. I think I have seen some newer resources that may have actually lowered it to 2. But still, like I said, like in my fertility assessment or preconception assessment, I'm already flagging things in my mind that I need to rule out in order, again, to maintain that insurance with the pregnancy. So family history is important, right? Like if we know there's autoimmune conditions in your family, or you've been diagnosed with an autoimmune condition, an immunological component can be a risk factor for early pregnancy loss, whether that be celiac disease, whether that be Hashimoto's, whether that be lupus. And for some women, it doesn't even necessarily have to be that they are presenting with that condition, because they can actually still have those antibodies being elevated in their system, which is not allowing for implantation. The endometrial lining and environment is so fascinating. Like, I think this is where we're really getting into like the research. This is where, again, my nerd brain goes and all the rabbit holes happen. And we don't have all the answers yet, but it's this huge immunological fluctuation that needs to happen. So we have like a slightly overactive immune system, and then our immune system kind of drops, allows for implantation. And then through pregnancy, our immune system is slightly lowered, right? Because we don't want to attack the baby that's growing inside of us, right? So that's why a lot of autoimmune conditions actually get better in pregnancy, is because of, this protective effect that's happening within the body. Again, also, like I said, your fertility journey doesn't stop when you get pregnant. So, PCOS, we know women with PCOS have more difficulty with ovulation, right? So we call it anovulation or oligo-ovulation. So maybe they're not ovulating on every single cycle. And we know that if women aren't effectively ovulating, we're not producing progesterone, right? And progesterone is what's responsible for maintaining our uterine lining. So if we do ovulate with PCOS, whether that be that people are doing the work and they had an ovulation on that cycle, or whether they're using a medication to support ovulation like Clomid or Letrozole, they may have a higher susceptibility that they're not producing enough progesterone. They don't maintain that uterine lining, and that results in a pregnancy loss. So again, we're assessing those factors and we're being proactive with that.
And I think that when it comes to the repetitive loss and having so many miscarriages, one thing that's really important to touch on is that if you're seeking out any kind of art therapy, IVF, IUI, is that there are tests that come along with that. Like they are testing the system. And we often, I like to say that a lot of women jump into these procedures after loss because it's almost a comfort of thinking, okay, I've had a loss. Now there is this tool, this medical tool that can bypass how my body's broken and I'll get a pregnancy. Even though the clinics are pretty clear that, they can't guarantee pregnancy, but there is something neurologically in our mind that's like, well, if it's my body that's doing this, then this can help, right? And then we go through all these tests that have to happen. And these tests sometimes give us information that isn't helpful for us, but it's helpful for them, right? And can sometimes make us feel a little bit more broken or make us feel like there is less of a success chance, whether that is all of a sudden we get a test done and we find out that we have diminished ovarian reserve, or, the sperm is tested and the sperm is slow. And so then all of a sudden we get impacted with too much information that feeds into this brokenness. How do you work with clients with trying to balance, knowing that we actually just got more information, which is great, but this isn't the full story?
Yeah, it's a hard thing to balance because I never, ever want to make people feel guilty or blame their body. And I think too, sometimes this can happen in the duality of even a relationship of like, is it female factor or is it male factor? And then I work with primarily it's the women coming to see me. Some partners are really invested in that process and they're like, yep, I'll do anything. But there are also men who's like, it's not my problem. And so there's a lot of, again, blame, guilt, shame that's perpetuated. And even when even after loss, I always want to reassure women, it's nothing that you did. Because we were like, I went for a bike ride that day. I had sex with my partner. I lifted weights at the gym. And I'm like, you didn't do this, right? It's not anything that you did that caused this loss. And so I'm always reassuring my patients for that. But it's a hard line to use those diagnostic tools and gain that information because I'm just trying to remove obstacles. I don't want to be like, you're broken or blame you, but it's if I can identify that, I'm going to increase your chances of, a successful pregnancy resulting in a baby, because that's what our goal is. That's what we want. And that needs to be, and so I always gain feedback from my patients. It's like, we can go through those tests kind of line by line, why we're investigating these things, what these tests mean, if they're positive or negative, and what your options are with that. It's a fine line, but I'm usually getting, that feedback from my patients of what they're interested in. But for me, it's just like my medical brain is always like, how can I best support you and remove those obstacles for your goal?
Mm-hmm. When you're talking, because you had mentioned about male factor as well. Can you share your famous statement that I love and all my clients to this day still repeat that this is their favorite quote?
Yeah. Yeah.
Perfect.
So fertility is like a group project, right? So you're doing all the research, all the reading, all the testing, all the poking, all the prodding. Your partner brings the markers and you both get the same grade, right? So it's just like and it just triggers like, like school days where you're like, yeah, you do the whole project for everybody. But male factor fertility plays a huge role. And honestly, sometimes even more so with recurrent pregnancy loss. So there are like really interesting statistics with what we call like DNA fragmentation of sperm. That can affect maintenance of a pregnancy. We also see, interestingly, say cannabis use, a really fantastic study that talked about male cannabis use actually having a greater increased likelihood of miscarriage than even female cannabis use. So it was more profoundly related to that male factor than actually the female factor. And I think, especially with miscarriage, that the mentality is like, my body is broken. But again, the male factor part is hugely important when it comes to fertility.
Mm-hmm. So feel free to tell your partners that they have to bring more than the crayons.
Mm-hmm.
There's more to this art project than just the crayons. So, because I think that is a huge part of it. I think, even myself, I remember when I was going through my ectopic pregnancies, the first one, I remember when we got diagnosed going, shit, I did handstands all for the last 2 weeks. It must have been me doing handstands that kept the egg high. And like my brain went into all these stories of how it was my fault. And it was probably after our second ectopic that I had an acupuncturist that said, it might not be you at all. Just because it's happening in your fallopian tube and you're associating with your egg not getting down quick enough, it might actually be that his sperm are not swimming fast enough or swimming too fast. Like it can be a him problem and not just you, right? And so don't just assume that because it's happening in your body that it's a you factor. And I think that was the first time, and I don't know why, in my head, it was just, well, ectopic pregnancy has to be me. My body's broken. And the amount of guilt that went with that, especially after, because I had 3 ectopics, every ectopic pregnancy was a new layer of guilt of, I'm holding you back. And I remember even having a conversation because my husband and I weren't married at the time, which interestingly enough, I always think is a part of the reason why I was having ectopic pregnancies, because he was very much not pro marriage because his parents weren't married. And I was very much, we need a piece of paper. And I think because my parents were teens when they had me, and I think that carried over in my mentality that if I get pregnant out of wedlock, that I'm going to be judged like they were, even though they were 16 and I was 32. Big difference. But I think I held all that tension. And in my own mind, I was like, this can't happen because I'm going to be judged. Like, there was so much worry there. So it's really interesting that once we got married, it was a month after our wedding that we successfully got pregnant, and not with art, not with reproductive technology, naturally on our own. So how did I heal my tube? I don't know. So a part of me thinks it was the psychological stuff. But through all of those, I remember us having a conversation at one point. It was probably after the third one of me going, are you sure you want to get married? Like, I can't give you kids. Like it's my body, right? And there was this, we had to have this really deep heart to heart of what if we can't have kids? What is it my body, right? And, that was he didn't know I was carrying that weight. And it was really a profound moment for both of us to realize how much stress I was holding of blame, and how much I felt like I was holding him back in his life of what he wanted. Mm-hmm. And so for anyone that's going through recurring loss right now, whether it is miscarriages, ectopics, whatever the case may be, if you've been told that you had to terminate a pregnancy for whatever reason, and there's a whole gamut of reasons why women have to terminate pregnancies for their own personal health, is that grief, that worry, that brokenness has a huge role, I think, sometimes to play on our healing journey and those bigger conversations to have, the psychological barriers.
Mm-hmm. Yeah. Yeah. And I think as a women's health advocate, or whether it's a feminist movement, I think in medicine, we really devalue the male's implication in fertility. And I think that pretty much the only test that's done is a semen analysis, right? So we're not investigating like chronic health conditions. We're not investigating medications that man may be on that's affecting their amount of sperm, right? I had a couple that was, struggling with fertility, and their physician told the male that he could remain on minocycline for his acne and it didn't affect sperm quality. A 2-minute Google search or reading like about minocycline, there's documented cases of it affecting sperm quality. And so again, it's just like, no, it's the woman's issue. So I really want to evolve this conversation around like male factor fertility. And again, that's perpetuated in ART in that, we'll just use technology to bypass issues with sperm. So we're not even going to investigate it at this point. We're going to use IUI. We're going to spin the sperm. We're going to concentrate it. And it's not a sperm issue. It's an egg or it's an implantation issue. So even that's perpetuated in, reproductive technology as well. So I'm always an advocate of let's get the swimmers in check. Let's get that fallopian swim team in check. Yeah.
Well, and one comment that you made there that I think is really important for us to focus on too is that when we look at the human body is systems. Like we have an immune system, we had the cardiovascular system, we have a respiratory system, we have a reproductive system. And these systems, although we like to label them as independent, they all work together. Like our body can't say, hey, screw you, cardiovascular, we don't need you. We're going to rule the roost here because we're reproductive, right? Like we all work together. And when one is out of sync, they all rally together to help hold the load for that one to find homeostasis or balance or healing, right? And so talking about like male infertility or male factors, is looking at the fact that we have to look at the full system. We can't just look at the sperm. It's not just a sperm thing. It is all systems. Like, is there anywhere in your system that's working a little bit harder that your sperm's like, I'll take a back seat so that way we can keep you healthy for living and thriving. And then someday we'll get back to paying attention to me, right? So
yeah. And two, like, I think you make a good point about systems because sometimes we're solely focused on hormones when it comes to fertility. And that's why if somebody has experienced a loss or recurrent pregnancy losses, I'm sensitively asking a lot of questions around when that loss occurred, because that can give us information as to, again, an obstacle in maintaining that pregnancy. So for instance, we have different stages of a pregnancy. So we have pre-embryonic, embryonic, and fetal stages. And if the loss occurs in one of these stages, it helps us narrow down the different causes that it can affect the loss. So for instance, in more of that like pre-embryonic state, this is where we see more of the quote unquote common miscarriages. And it's a lot about cellular replication, right? But again, the reason for the first miscarriage can also be the same reason for the second, third, fourth. So if it's a chronic issue of cellular replication, we're looking at egg quality, right? We're looking at sperm quality, and we're optimizing that to be able to reduce the incidence or reduce the probability that genetic information isn't going to become replicated, right? So that is one factor in that pre-embryonic stage. And hormonal factors, I would say, are probably another predominant one in that stage as well, where we're looking at progesterone. We're looking at thyroid hormone, and thyroid hormone is huge when it comes to pregnancy loss, and not just TSH or how the brain is talking to their thyroid, but also are there thyroid antibodies that are affecting thyroid function? And this can be bubbling under the surface, and we don't actually see that being reflected in your TSH or these thyroid stimulating hormones until years later. But again, that's an immune marker. And as we progress in the pregnancy, those genetic components are less likely, right? Because if there's an issue with replicating those cells, that's going to be regulated fairly early on. But if we're seeing a loss like after 12 weeks, maybe later on in the pregnancy, stillbirth, we're looking at other factors. Is it still hormonal or metabolic, like thyroid function? Is there an immune component as well? Then you'd mentioned the cardiovascular system. Is there an issue with circulation? And I think that this is one thing that might be missed oftentimes. Sometimes we see that early in pregnancy as being associated with the loss because the placenta can't properly form. But we can see issues with circulation later on that restricts fetal growth and then results in a loss in the pregnancy. So circulation is hugely important. That's why even we're incorporating yoga, pelvic circulation, all of those things are super important for a pregnancy. That's why in Chinese medicine, we tell people to wear socks to keep your uterus warm, keep your feet warm, keep your uterus warm. So clotting factors can be an issue. So we see that with cardiovascular inflammation, there's different markers that we can assess for. We can assess for different clotting factors. And again, there's autoimmune conditions that perpetuate or worsen those clotting factors. And you don't necessarily have to have a clot or 3 pregnancy losses, which is kind of the diagnostic criteria for this condition. It's called antiphospholipid syndrome, or APS. You don't have to have that diagnostic criteria or 3 losses or say a history of clotting. You can have those antibodies being elevated that are affecting your ability to stay pregnant. So again, it's really looking at where the loss occurred and what is happening in that system that is preventing that from progressing. Like, what part of the baby are we developing at that point? What is a natural or physiological change that's happening in that woman at that stage of a pregnancy that helps us really dial in? And this is where that investigative work really happens. I don't want you to have I don't want anybody to have any losses, but I don't want you to have to get to that 2nd or 3rd loss for these things to be investigated.
So when would you say is important for us as women to start seeking intervention or help for pregnancy loss?
Yeah. So I would say if there has been difficulties getting pregnant, that we want to ensure that we're looking at contingency plans. So we're investigating those things when you're pregnant, or again, very early on. So we don't have to do that after your first loss. If there's challenges in getting pregnant, that might also be a challenge to stay pregnant. So having your care provider rule in or rule out some of those factors in part of your fertility workup. So then even after a first loss is where we can look to still support you or start that investigative process. Again, probably the most common is we're looking to support egg and sperm quality to help support the probability that genetic material and that cellular replication is going to happen properly to, again, perpetuate or maintain the pregnancy. So I would say even after a first loss, we can start that investigative process.
Mm-hmm. And, I would also probably put out there too, that if children is on your mind at some point, doesn't have to be this year or whatever, but you're like, you know what, someday I'm going to be a mom. If you're having cycle issues, this is the time to explore it, because a healthy menstrual cycle equivalates to a healthy fertility journey. They don't separate. And it's always really interesting when I'm offering something that is for cycle health in one of my programs, and women are like, oh, but I want to just focus on fertility. It's like, well, you can't separate the two. So if you notice patterns already happening, whether it be that you've been diagnosed with endometriosis, fibroids, PCOS, any of those things, or that you just have these really painful and heavy periods, or you have like massive migraines, like these are the times to start exploring, because the more that we heal our cycle, we are ultimately healing our reproductive system. And then down the road, if you wish to have children, we've already done some pre-work to create balance and harmony in the body too. So,
Yeah, I remember in med school, I was in just my last year of clinical, and I was working up like a woman's cycle and concerns. I think for her, it was PMS. And I told my supervisor that I had wanted to run like a day 21 progesterone, or like 7 days post ovulation to investigate. And he asked me, is she trying to get pregnant? And I said, no. And then he's like, then why does it matter if she's ovulating? And that was like the most I remember that definitively. And I was like, we need to change the conversation around hormonal health, because if there's a piece of physiology that isn't functioning as we want it to, that has a trickle down effect, right? And I've seen that because we again put our detective caps on, and I'm doing things and investigating people's past medical history for their current concerns. I have people who are like chronic non-ovulators. They had years and years and years without progesterone, and progesterone helps regulate your immune system. So now all of this autoimmune stuff is popping up in this woman. And she's like, yeah, it was years and years and years of trying to get pregnant. I had high prolactin. It was never really dealt with. And then now I'm kind of dealing with all these repercussions. So period health is your fifth vital sign, right? Your period tells us so much about your health. It's just like your daily poop report card, right? So if your poop is telling you something, that there's something off in your digestive health, we're listening and we're paying attention to that. If there's something that's happening with your menstrual cycle, this is your fifth vital sign, and we want to support your overall system with that.
Because it will help your fertility, and it will help menopause, and it will help longevity into our elderly years with bone density and, chances of diabetes and heart conditions. Like, our hormone health is so important for so much that is like futurescaping that we haven't even got to yet, but we need to plan for. So our body's talking to us now. Let's get it into balance. So one final thing that I'd like to talk really quickly about with you before we sign off here today. And once again, this is just something that came really prevalent in some of my discussions I was having with women that were doing IVF for fertility, that were dealing with losses. And it's going back to that conversation of language once again. And I'm going to use this as my little soap stand here, or my little stand, whatever you want to call it, to kind of just do this little shout out here of that one way that I think that reproductive technology has really failed women in helping them move through loss and grief is that when we do an IVF or an IUI cycle and it doesn't take, or like quote unquote take, we say it's a failed IVF. And women who come to me that have been working with me and then have a failed IVF, they're always devastated. And one of the first things I work with them is changing the language around it. Does it feel better to call it a miscarriage? Because realistically, that's what it was. We had a fertilized egg. Like, what we would see if we didn't have that intervention is a sperm meeting the egg in the body. And we're hoping for it to become fertilized and implant, right? And then if it didn't implant, we would say that you had a chemical pregnancy, or we label it as a miscarriage. And when we do IVF, for some reason, we've created this language now that it's like, no, it was just a failed IVF, where for a woman who's invested emotionally, financially, and physically with all the drugs she's had to take, that is a loss. And so now that we're talking about miscarriage and recurring losses, for anybody out there who's been doing IVF or IUI or is thinking about it and it doesn't take, know that you are okay to claim it as a miscarriage. It is perfectly okay to say that I miscarried. If that's what you need to say to the world, I highly encourage it, because when you're talking with family and friends and you've invested so much, it really doesn't feel aligned to say it was just a failed medical attempt, right? Because it wasn't a failed medical attempt. There was a fertilized egg. So it was a loss, and it is a loss. It's a loss on so many levels for you because you've invested so much into it. So yeah. I think that's really important language. And I like that. I think I'll use that with my patients for sure. And I think subconsciously, even though I'm not necessarily communicating this to people who have didn't have an embryo transfer take, I'm medically still in that mindset of like, I would investigate that the same way that I would a loss at, 4 weeks. Right. Mm-hmm. So I think medically my brain is doing that, but I think the importance of communicating that and having that dialogue and that conversation with my patients will be, really, really profound. Yeah. All right. So I love ending these calls, some kind of womb-led tip. Women who are on this fertility journey, do you have a tip for them?
I think before I get into my tip, I just want to reiterate something that we've said in the conversation, is that it's nothing that you did, right? And I don't want blame and guilt perpetuated with losses. It's nothing that you did. And then in this investigative process or in the supportive process is just how can we remove any obstacles to support your goal. But in regards to my tip, one thing that I think is hugely important in the fertility world, and it seems like something that's so benign that it's almost like, oh, that can't make a difference, is vitamin D status. Okay. Vitamin D status is so important. And we think about like vitamin D again as this innocent supplement, or people like, oh, I get it from the sun, I don't need to supplement, or there's this potential lack of awareness. But vitamin D actually functions more like a hormone than it does a vitamin. So it has crucial roles when it comes to hormonal regularity, when it comes to your cycle, when it comes to ovulation, when it comes to supporting hormones that again are going to maintain the endometrial lining. It looks to balance the immune system. Again, we talk about like reproductive immunology is this whole new growing field of study when it comes to fertility. And again, vitamin D is this like innocent little, it's kind of like, it's not a sexy vitamin, right? Like I talk about nutrition and like broccoli, and I think broccoli is the bomb, but people want these goji berries and stuff. But I'm like, we just need to make broccoli sexier. We need to make sexy because it is so impactful when it comes to fertility in a number of different ways. So conventionally, you can't get your levels checked unless you have a medical exemption. So if you have, severe osteoporosis or an autoimmune condition, you can do this privately to understand your vitamin D levels. And so you can get your vitamin D levels tested, and then you can dose appropriately. So a lot of us are deficient in vitamin D. The recommended daily allowance of vitamin D has actually changed. It used to be 1,000 international units daily. That was the recommendation. That has actually increased to 2,500 units, international units. So if you have any questions with vitamin D, certainly ask your care provider, but don't undervalue the impact of vitamin D, or we should call it hormone D. Yeah.
I was just going to say my mind is blown right now because I did not know this about vitamin D. I always just linked it to the immune system. So now to me that you've linked it to hormone, it does seem a lot more sexier to me. So I will not forget to take my vitamin D now. And it's really interesting because I just had this conversation about vitamin D because it was recommended to me that, perhaps with my hormone test that I had done, the Dutch test, that I should get my vitamin D levels checked. But I was warned, can't get it checked through a doctor unless if you are some kind of special human being that then, they will write you a letter that has to go to the medical board and you'll probably still get denied because they don't see the value in it. So if you want to do it, you have to do it privately. And we send it off to the States and here's the price tag with it. And it just blew my mind that we have to go through this process of asking for such an important test. Like what you just said, like this is not just a vitamin. This is so much more. Mm-hmm. Yeah. A new thing to feel riled about in my body.
Yeah. I was like, next soapbox that we can move to. Oh yeah.
Vitamin D, here we come. But now vitamin D is sexy. I'm going to promote that. Our sexy supplement. Sexy supplement. Yeah. I love it. This was such a great conversation. Oh, and I hope this was so helpful to so many women out there that are on this journey. If it hasn't been recited enough here for you to really have it lodge into your brain in so many different areas, Dr. Lutz and I are both promoting that your journey is not over. There is so much hope, regardless of how many losses you've had, regardless of what's going on, regardless of your age. I have worked with so many women that have gone through recurring loss that are now mothers. So it's just about building your team, and building your team is a team that's going to give you so many helpful resources to make you feel empowered. So, definitely look into your options. Now, Dr. Lutz, you have an exciting offer coming up right away here. Do you want to share a little bit about your workshop or your intensive?
I would love to. So, Full Functional Healthcare, which is the clinic that I work at, we are offering a fertility intensive. This is the first one we've run at the end of Infertility Awareness Week. So Friday, April 28th. This is an online fertility intensive called What to Expect When You're Not Expecting. And through that 2-hour intensive, we're going to zip through many different conditions, many different approaches, or things that I wish, everybody understood before they even come into my office to see me. So we'll be going over the menstrual cycle or ovulatory cycle to understand your fertile window, including discussing testing that may be indicated just based on your menstrual cycle and in supporting your fertility. We'll go through PCOS. We will touch on recurrent pregnancy loss as well. Our dietitian, Katie, will be talking about the impact of nutrition on fertility and most specifically with the Mediterranean diet. I will, of course, touch on male fertility because I think this is hugely important to the conversation. And then I'll give a brief overview of ART or assisted reproductive technology, including IUI and IVF. So lots crammed into our 2-hour intensive. And that will be 3 p.m. Mountain Time. And this isn't just available to people in Alberta. This is anybody can attend this because this is information that's universal. It's not just, again, working one-on-one in Alberta. So yeah, Friday, April 28th is when this will be happening.
And I'll add the link down in the show notes for anyone that's interested so that you can register and join. And, one thing, while I have you here too, that just to put out there, if you are interested and you love this conversation, follow Dr. Briana Lutz on Instagram. You can also follow the clinic that she works at, which is Flow Functional Health, because they also offer a really great other online experience, which I've heard so many people rave about, which is your collective that you hold, that 6-week intensive, which you only offer a few times a year. So it's not right now. But follow them, because when it does pop up again as an opportunity to come and join that is another great opportunity to start to see how you can heal your reproductive health, not just for reproduction, but for cycle health and for longevity and transitions through the different phases of your cycle or phases of your life. Sorry. And what is it called again?
It's called the Wild Collective.
Collective.
Yeah. And there is also a program that we can run simultaneously with that. It's called the Wild Mama. So it is geared to be smaller, in person, and not as long as the Wild Collective. And again, it's more geared towards new moms or repeat moms. So yeah, we're here to support you in every stage of the fertility journey. So getting you pregnant, keeping you pregnant, and then celebrating baby and you after that experience. Yeah.
So follow both Flow Functional Health and Dr. Briana Lutz on Instagram. Their links will be down below in the show notes as well. And I hope everyone that's on this trying journey is just feeling like they've just had an hour of being held and supported in this conversation, because you have so many people cheering you on. So thank you for coming and joining us and having this conversation and sharing your wealth of knowledge. It's been so fun interacting with you here on the podcast.
Thank you so much for having me.
Are you excited about aligning to your cycle? If so, make sure that you subscribe to this podcast and like the episode if it really resonated with you. Until next time, remember, womb wisdom equals connection to self, which ultimately equals inspired living.